2015, I had a heart attack and had an 85% blockage in my LAD. Having to deal with two COVID issue back in 2023, it didn't really help out. So
Yeah.
that just
That
becomes
put the
another
whole
problem.
country in cell danger response.
But the other issue is the risk factor of putting drugs that containing fluoride groups together. So commonly when you're talking about fluocinolones, you could be having prescription of NSAIDs, ibuprofen, naproxen. Those all contain fluoride group.
Ha! I didn't know that.
Prednisone that also contains fluoride group as well. So we have to put those together. The risk factor of being fluxed becomes higher.
The information shared on the Rethink It podcast is intended for educational and informational purposes only and should not be taken as medical advice. While Dr. Sande is a licensed medical provider, the content of this podcast is not a substitute for professional medical diagnosis, treatment, or advice specific to your individual health needs. Always consult with your healthcare provider before making any decisions related to your health or medical care.
Welcome back to the Rethink It podcast. I am so glad you guys are here today. I know you hear me say it every time, but you're going to love this podcast and who I'm bringing on today. I am bringing to you a interview I just finished with John Kim. He's a pharmacist, a PharmD from New Jersey. He owns some pharmacy companies across that area. I'm not exactly clear on all the pharmacist stuff that he does because I know him from the functional space where he actually does a telehealth or virtual consulting practice similar to what I do. And his specialty is mold toxicity, biotoxin, and cell danger response. So right up our alley, things you've probably heard me talk about. We touch on in this interview, we touch on quite a few things. The main reason I wanted to bring him on was because I've heard him lecture. One of my favorite lectures that he did was at a conference where he talked about drugs, commonly prescribed drugs, and the impact they have on balance in the body. And so this is not a lecture or an interview where we're just here to trash pharmaceutical medications or anything like that. It's just to make you aware of the impact that these drugs have on our body, in particular leading to deficiencies that lead to dysfunction. If you've heard me talk before about drugs, you know that I always say that one drug leads to 4 drugs or more, and that's why we rarely have a person on one drug only. At least when I see them in the hospital, that's almost never the case. So there's a reason for that. And we're going to delve into that in this conversation. We talk about some of the classic nutritional deficiencies that occur with many of the most commonly prescribed drugs like statin drugs, even albuterol. We touch on some of the benzodiazepine drugs, antihistamines, Pepsid, Zantac, all of the things. So all the things that you will commonly see prescribed, we're hitting them today. We do jump out of the gates, hitting the ground running, and just talking about cell danger response, which is, one of my favorite things to talk about because it affects everything in our development and neurologic development and neurologic decline and everything in between. Our bodies are so highly influenced by our mitochondria. And so we do jump right out the gates, throw it into the science and really just jump in. But just believe me, hang in there if it's too much science right out the gates, because we do talk about what led John down this road, and it's a compelling story where he begins his whole functional medicine experience and into this world with a heart attack at the age of 33. So you want to hear him tell his story. You want to hear all about these drugs and some of the things you can do to prevent some of the downstream effects of taking pharmaceutical medications that may be necessary for you. So tune in, lean in, take notes, and enjoy the ride. Well, welcome back to welcome for the first time ever, Dr. Kim, to the Rethink It podcast. I'm so glad you are here with us today. I've been waiting to interview you for over a year. I'm so glad you're here. I have so many people have questions that I know that you can answer, and I just enjoy bantering back and forth with somebody else who's got expertise in the area that I enjoy to talk about. So, Dr. Kim, your experience right now, you're doing a lot of specialty in the whole cell danger response and mold toxicity world. I talk about cell danger response a lot, but I want you to kind of give the elementary level, or well, high school level, a kind of explanation of what that is so that people can understand what it is.
Sure. Cell danger response is basically a response of a cell to keep you alive, basically. That's
Right.
exactly what it comes out to. So what's causing that issue that your cell is trying to survive? Well, there's different stresses you're getting involved too. Talking about different microbiomes, especially you talk about viruses, parasites, mold, and bacteria that could affect a particular infection and innate immune response in the body. Second, it could be chemical related, where you have different things in terms of heavy metal getting involved or different solvents, air fresheners for that matter, can also trigger a lot of issues for people dealing with sensitivity problem. So all these things are end up having to cause a heightened issue of immune response as well. And the third could be more related to a physical attack or physical issue, such as you have a burn or cut on the body. The sunburn is a big thing that we end up having to talk a lot about, how that overall, if the healing doesn't occur very well, that could affect the skin structure and potentially lead into cancer down the line. But again, that's another potential issue there. And then the last thing could be psychological, where you're dealing with physical, mental, and emotional psychological trauma leading into potential PTSD. And that could also lead into issue where you have a nervous system dysregulation, which can also trigger response in dealing with potentially mast cell activation, some people, histamine response as well. So there's a lot of things going on. So why this is such an important topic to talk about in just about cell danger response is that it is a term that was coined by Dr. Robert Navio. He's an MD, PhD out of UC Davis. And this particular phenomenon of cell danger response to really understand the metabolomic changes going on within the cell in the body to describe what's going on in the autism spectrum world, right? We just couldn't really understand what's leading into this particular phase of spectrum disorder, but also there's different spectrum aspect where kids who are still verbal, whereas the other side would be completely nonverbal and being dependent 100%. And so this is a particular phenomenon that he was trying to really understand, and digressing to that, really understanding what's happening within the cell. So we always think that once you have a triggering issue on the cell responds and try to fix it, but there's a lot bigger issue where early onset of cell danger response, there's a triggering of some sort. So let's just say you talk about a virus, for instance. Virus triggers a cell membrane, which causes a depolarization, affecting the mitochondria to sense that there is some issue going on. So instead of making energy, it shuts the energy down and then end up having to go into more of a defense mode, basically. And that in this.
So we're talking about voltage changes. So like
Voltage change,
electrical
absolutely.
voltage changes of the cell are identified by the mitochondria. I love that because I try to tell people, I'm like, did you know the mitochondria? We all know it's the powerhouse of the cell, but did you also know that it was a voltmeter? Like it picks up voltage and like it picks these things up and it notices a change and like you said the fancy term depolarization, but like changes of the cell voltage, that's a voltmeter. So it doesn't just make it actually senses it. It's really cool.
Absolutely. And our entire cell membrane has different voltage channels and potentials that goes on is why I talk a lot about circadian biology and as well as the type of water the body creates into creating easy water and structured water that in itself, there's a fourth phase of water.
Right.
Obviously, that's not a topic that we're going to be discussing today,
I
but
love it though.
I
love it.
There's a huge side underneath of why you need to get your cells back in order. It's not just about the binders, the antimicrobials and different things, but really understand the role of the mitochondria and what a mitochondria does in essence of keeping us alive and keeping in homeostasis. So going back to the discussion wise, the mitochondria also causes the cell membrane to pump out phospholipids to lock in that particular cell to keep that potential viral issue or any other danger from egressing out and then attacking other cells. And it also pumps out at different antimicrobials and as well as a hydrogen peroxide within the cell to neutralize that pathogen. But one of the fascinating thing is that the cell is trying to go through this process to go into mitophagy or autophagy for that matter. So any damaged cells, the mitochondria is trying to recycle and renew, and this is a normal part of our cell phenomenon.
Right.
Another thing that the mitochondria also does is it dictates the methylation process. Pathogens like viruses,
The methylation process.
it end up having to hijack the methylation so that it starts to replicate it within the cell. To prevent that from happening, the mitochondria shuts the entire methylation down.
Well, I
So
really
that's
want people to
another.
hear that.
So that's
I really
another
want them to hear that.
that's another phenomenon that actually occurs. But
Yeah.
what's happening within the functional medicine world, where we measure methylation, MTHFR, we're so busy giving out methylated B vitamins too early, and these patients get worse. And I've seen this happening for a lot of people, where if you don't really understand the role of methylation, instead, what I recommend doing is really supporting the methyltransferase choline pathway. And if you look at that, what it creates is phosphocholine and creatine within the cells. So the way to do it, you supplement them those with two nutrients, and then ease that methylation away from the mitochondria and supporting the proper cycle of the homocysteine level. So that's one way to really ease that through. And a lot of people who have sensitivity issue with B vitamins, they tend to do better that way.
That
right?
totally makes sense,
So
yeah.
that's another thing. And then another thing that mitochondria does is within that structure, a structure of phenomena within that phase, it also triggers a response to other cells that there is something going on, that you need to bring other immunoglobulins, especially macrophages and neutrophils and lymphocytes, and also sends a signal to your brain to sense that, hey, you are sick, let's reserve your energy and rest. So that sick response
Major
is exactly
biocell communication, like
right.
it's the whole system.
The whole thing there. And
Yeah.
then when you
So
go to the
amazing.
next phase is all dealing with the healing cycle. And
Right.
the issue of why we actually have a chronic disease state, especially autoimmune disease and especially PTSD, is improper healing cycle, where the cells or within the cycle of the healing get either stuck or end up having to be the innate immune response or inflammatory response is turned on too often, or there's a overall epigenetic changes that goes on, right? So to support differentiation of the cell structure and function, leading into a particular disease states, or your body end up having to respond in a autoimmune fashion where your cells are actually, your immune cells are attacking each other.
Attacking each other.
Right.
Yeah, it's amazing. And if the body cell's not able to get out of that state, right, and we stay in that stuck in that cell danger response, which is meant to be a hormesis response, like a response to make the body more adapted, then we end up with this chronic state. That's what you're saying. I know that this education, I know that was welcome to the fire hydrant. Here's the education. I know this was like a hard-earned education for you, because I heard your story. I heard you share the story when you were talking about phosphatidylcholine at one of these lectures. And so you shared a little bit about your own journey of healing and that process. Do you mind sharing some of that?
Yeah, so
For a second.
so 2015, I had a heart attack and had an 85% blockage in my LAD. So
Holy crap.
So I had a stent put in, and during that time, age of 33 years old, I mean, you don't really expect anything to be happening of that nature. And I just got back from my friend's wedding, and 4 days later, that's what exactly happened.
Holy cow.
And I thought I was just dealing with a heartburn, because that's always something that I would end up having to deal with. And I had a very poor gut function, really didn't quite understand the facet behind that. And I thought I was just going to treat it with some digestive enzymes and doing that. But end up getting a stent put in. I was in cardiac ICU unit for 3 days, and then just wondering what had happened. What could I have done differently? So I got home, sat on my couch for 7 days, just wondering what I need to do career-wise. Do I need to quit being a pharmacy owner? Do I need to do other things?
Your background there was you were acting, or currently a when this happened, you were a pharmacist. Is this correct?
I'm still a pharmacist. I
Right.
own
But
a
you
community
were-
pharmacy. Yeah, I own a community pharmacy in Mendon, New Jersey, but I have a side consulting, functional practice where I consult clients dealing with, biotoxin issues. So simple nutritional profile and support that I give. So that's the gambit of it. But that's the journey basically, and having that meet the Jesus moment where you start questioning a lot of things. And I went to my functional doctor, who's I've been friends with since 2006, and I thought I was just getting a vitamin C drip done because I thought I needed it. And the doctor said, I think you are dealing with some kind of tick-borne illness. So that's when we decided to do additional testing. And after about a 2 month later, I was tested positive for Bartonella, high levels of mold antibodies, especially Aspergillus, Mycoplasma pneumoniae, Epstein-Barr, and parasitic issues on top of heavy metals. Right, so there are multiple layers of infections
things
on
that are
top of
causing cell
biotoxins.
danger response.
Right. But there was a lot a lot more into that picture. I mean, I didn't really understand how much of a childhood trauma and psychological issues that went on as a child when I was 10 years old plays into effect in terms of doing this, because when you have a increase in stress response and microglial activation, that also leads into leaky gut and all the inflammatory conditions that comes through. And that becomes a good leeway to mold to come in. And then mold is going to just downward triggering different cytokine activity, inflammation, leaky gut, especially when you're having, mass amount of damage in the cell membrane. And I talk a lot about how forming of peroxisomes and lipid peroxidation of the cell membrane structure. And then when you have a depletion of healthy amounts of essential fatty acids and phospholipids to really getting the essential part of the cell membrane intact, that just becomes a leeway for other things to come through. So one of the things that I always talk about is this, we talk about, and especially when you go to certain conferences, I'm not going to mention where, but they talk a lot about parasites. But parasites don't really come in when you have a clean terrain. It's when you actually have a dirty terrain affecting that. And then that becomes a leeway for all the pathogens to come through. It's almost like one guy comes in and then let everybody else come into the party.
Right.
Yeah. It's like, here, it's open. Like, just let's come right in.
The bar's open. Come on in.
Yeah.
They're serving free drinks.
Yeah, exactly. And free drinks is your body's natural ability to heal itself and be well and such. And there's a lot of questionable things that were going on. Leaky gut was a big one for me. I mean, I had very bad breath, and I didn't really understand. I thought it was just the overall dental issues, but no, there was major underlying of mold colonization in the gut, cystic acne all over my face, especially around my forehead and my chin. So you already have a high issue of a liver being backed up and bile issue as well.
Yeah.
Right, and then you had food sensitivity issues. So anytime I had any red meat, I would have indigestion.
Wow.
Right, so that was that high histamine response. I was always had rashes around my lips. Right, so there's a lot of things that went on, but I didn't really question that this is a triggering issue from possibly mold, could be from parasites. But when you talk about also Bartonella infection, which is not really rarely talked about, Bartonella actually causes endothelial damage.
Oh wow, I did not know that.
Right, so that causes endothelial damage, and you have oxidation going on,
that
and then you have
low nitric oxide, and the average person who doesn't breathe through their nose.
A lot of things happening going on. So it's luckily enough, I was able to just have a stent put in, and it was just an end STEMI, got a stent put in. Of course, I had an 85% blockage, but even after 10 years, I had a full nuclear stress test done last year because I had a little bit of a issue. I thought I was having another heart attack, but unfortunately, when I was doing my detox protocol last year for myself, that went a little too hard, and that affected my digestion. So
pushed it a little too hard.
Too hard. And sometimes we cause that on our own.
Yeah. That's why layering and progressive detox is important.
Absolutely. So it's been great. 10 years so far. My nuclear stress testing came out
look like
clean.
a different person. You probably feel like a different person.
Yeah. But having to deal with 2 COVID issue back in 2023, it didn't really help out. So that just
that
becomes
put the
another
whole
problem.
country in cell danger response.
I think some of the people are still dealing with cell danger response, especially the mandate issues that went on, and
Right.
what we're seeing right now. So that's a whole different topic.
Yeah.
But yeah.
After your heart attack, did they put you on any medications, any of those classic medications, like an ACE inhibitor?
I love how you put it right in there. So yeah,
Hey, we were going
well,
to talk about drugs and the
yeah,
side
exactly.
effects of
Yeah,
drugs.
exactly. So let's talk about what Dr. John actually took. Number one, they put me on 80 milligrams of atorvastatin. I just clicked it on the
Atorvastatin, the
stint.
number one prescribed
Number
drug
of
in
cholesterol,
America.
right?
Yeah,
And
yeah,
that doesn't really stop you from having a secondary heart attack issue,
right.
right? So that doesn't prevent anything,
The
but this is
statin
what they do.
drug.
Statin drugs do not potentially cause any issue dealing with heart attack, but this
Reduce
is what they
they
do.
don't
Reduce
reduce.
the causation of a heart
Mm-hmm,
attack, or to prevent a heart attack even
mm-hmm,
after getting a stent put in,
mm-hmm,
right? But there's
mm-hmm.
a different role of why it actually does that is more related to the fact that it actually depletes vitamin K2, affects the
Mm-hmm.
microbiome, but also when you have a CoQ10 level depleted, you have a also dealing with insulin resistance going on too. So there's a lot
I
of
read
play
some
of that.
study that said that, like in the first 30 days of statin medications being given, that you get a 80% depletion in CoQ10. Is that correct? Something like that.
80% is one, but there's also dose dependent, where
Ah,
you actually have a leaking of the electrons out of the electron transport chain
no, this
as
is
well,
huge. It's the
right?
energy that the cell makes.
Right, and this
So,
is what's causing it. So you do have studies of statins being used in athletes, and they saw that the potential VO2 max and that the decrease, and then their endurance
VMAX
capacity
decrease.
also decreases as well because of it.
Wow, wow. So true cellular energy is declined because of both CoQ10 and the electron transfer. And then you
Right.
said K2 depletion, which that's leaky gut, but that's also a neuronal pathway, right? So you get a like nerve peripheral neuropathy. What do you call
Lovely.
it? Right,
Right.
right. Peripheral.
Yeah.
So yeah,
So
that's a
those are
big
the things. And then they usually put you on a blood thinner. So at that
right.
point in time, I was on geez, Plavix, so clopidogrel.
Mm-hmm.
And then on top of aspirin 81 milligrams. I was
Mm-hmm.
put on Divan and then metoprolol ER 25 milligrams. And I just don't quite understand at that point in time they put me on isosorbide 30 milligrams. So all these anti
Yeah.
hypertension drugs were added in. Obviously, there's an adrenergic issue they're trying to keep it under control. I get
Right,
it.
right. Yeah,
But they
yeah.
over medicated me. So after a month of being on it, one evening I was going to the bathroom and I had a case of syncope.
Right, because you
So
on nitroglycerine. I mean, my goodness. Stood up and whoop,
yep, I felt middle of the night, and I woke up the following morning
and you're on Plavix.
on a Plavix. I woke up the following morning when the sun was just coming up, and I'm just like completely dazed on a floor in the middle of my bedroom, and just wondering what the heck happened. So I called up my doctor, my cardiologist, and he told me to go to the hospital again. So I was admitted for 24 hours, and then they decided to, you know,
Change your
get
drug.
off. Well, they took me off of all of
Nitroglycerin.
them,
All of them.
except for statin drugs, Plavix, and aspirin.
Mm,
And then they put me on a 40 milligrams of Divan at that point in time. But that was the
mm,
only thing that put me on at that
mm,
point.
mm.
Because, again, this is where the therapy of and what the potential use of medication has to be very specific to the age group and as the population, the risk factor.
Yes,
But when
yes.
you are in a
33
hospital,
years old after a non-STEMI, and you're on nitroglycerin and metoprolol and Divan. My goodness
yeah,
gracious.
so
Your
that
blood
they
pressure
have
was
to
like
be
50.
right. So that means
Yeah,
they try to keep it as low as possible. But again, it doesn't really stand to fit to that particular population or that
right.
particular person. And
Yeah,
this is the problem that you see all the time. And
yeah.
it's not even just a hospital. When you are, I mean, I used to work in ER and as well as I was in the ICU unit working as a pharmacist there. And this is the problem with a lot of residents. And I'm not saying the residents are a problem but there's a poor understanding of just even putting a particular patient on PPIs,
Mm-hmm.
right? So
Great,
there's a
great segue
there's a
because I want to ask you
segue,
about PPIs.
right? So there's a risk factor of patients who are on ventilators, especially in an
Uh-huh.
ICU setting, that they could actually have a potential issue dealing with stomach bleeding,
Uh,
right? Or actual gastritis issues as well because of underlying stress response. But that stress response undertake causing microbiome issues as well. Because remember, what's happening when you are blowing all that air into the mouth except for the nose. You have poor nitrogen oxide production, right? Your
Right.
microbiome is a bit affected. So
Yep.
of course, it's going to be overall affecting the gut lining in general.
Sure.
So yes, there is a place and time into using PPIs, especially in ICU. But
Right.
for a regular telemetry unit and other
Right.
patients that are going to be in the hospital, to be putting them
On a
all
PPI
on
standard.
PPIs,
Yeah.
that is nuts. So this is the part that the clinical pharmacists would be doing rounds and then going through and then questioning why certain medications were started.
Right.
So
So our
it's a problem.
PPIs, just for the audience, would be your omeprazole, your what's the name for Pepsid? Your
Omeprazole,
Pepsid.
esomeprazole,
Yeah.
you have
What's the
lansoprazole.
generic or the brand name for
So
omeprazole?
esomeprazole will be Nexium.
Nexium,
Lansoprazole will be Plavix.
Plavix,
I'm sorry,
Protonix,
no, so
Proton,
sorry. Prevacid.
Prevacid. There you
And then
go.
Protonix is Pantoprazole.
There you go. All the
Yeah, there you go.
opazoles.
Those
Those
azoles,
are-
right?
Yeah, the azoles. Yeah.
And it's a permanent blocking of your proton pump. And so
Proton
you're
is your hydrogen.
right. So you're already
Yeah.
blocking that particular pump permanently.
Like this is really one of my pet peeves in chronic health. PPIs somebody being on PPIs, it really, really upsets me because of the downstream effects that happens with these, and they're so commonly prescribed. You want to talk about some of that? That I mean, there's just
So
I spent
when
a whole
you,
podcast on it.
yeah, it does not make a difference whether you're taking a PPI or H2 agonist. So H2 agonist would be Pepsid. Years ago, there used to be a drug called Zantac or ranitidine
Yeah,
that's
yeah.
taken off the market at this point in time. But generally, we talk about famotidine. It's available as over-the-counter now. So is PPIs, like Nexium is over-the-counter. So is Prilosec. But when you are reducing the acid production in the body, yes, you could have some instantaneous relief dealing with potentially heartburn or GERD, and rightfully so. In certain cases, you may have to use it when you have dealing with H. pylori problem, but there's a whole different discussion with that.
Yeah.
But there's a huge role of utilizing it. Issue using it long term, it actually depletes several nutrients. So CoQ10, B vitamins, B12, B12, B6, magnesium, vitamin D, manganese,
Holy cow!
calcium,
Like which other ones?
right?
Like all the main
Calcium,
ones.
iron,
Holy
right?
cow!
So all these things can be affected, but not only that, it actually affects the microbiome as well.
Correct.
So your risk of actually developing C. diff is much higher on a PPI than not being on it. You have a
Wow.
high risk actually of developing anemia because now you're depleting B12 and iron
Iron.
absorption. And then it also affects other nutrients that's requiring acid as well. So biggest thing would be minerals. So mineral depletion. What's happening when you deplete minerals, including calcium?
Molybdenum.
Molybdenum is another one. It
Yeah.
also depletes that, and then it risk factors osteoporosis. So you have a high hip fracture risk when you are on a PPI for a long period of time. So this is the
Wow.
part that's not being really talked about. So when
Yeah.
when an elderly patient, especially a female patient who's been on a PPI for a long period of time, and then when they're going for their potentially dealing with their bone scan,
Right.
right? They have a low bone density. They're put on a alendronate, so which is a Fosamax. And Fosamax is also another problem because it actually affects the gut lining, right? It tells you not to lie down after taking alendronate or Fosamax for an hour
Right.
because why? It actually really damaged the gut lining. So that's not what they
Wow.
want to do, right? So
Wow.
but then it doesn't really fortify the bone matrix.
Significant improvements in
Right.
bone density. Yeah.
So that when they compare the hip fracture ratio compared from not taking anything versus the Fosamax, the end results were the same, right? So
Wow.
what is the whole point of doing that? And any other osteoporosis drugs, even there are Prolia, for instance, that's an injectable hemoglobin-based osteoporosis drug that also does not really potentially help to fortify that bone more, except for it can cause immunosuppression, right?
Wow.
So what it does is actually preventing the bone remodeling that's supposed to be occurring.
Right.
So these are all the risk factors. So
Yeah.
when you talk about bone density also, that could also result from poor circadian biology mismatch.
I love this. So we're wearing both of our wearing our
Yeah.
our blue blockers today,
Yeah.
and that has a lot to do with what you're talking about here with the circadian biology. Um, Talk about that for a second.
Yeah.
What do you mean circadian
So
biology?
circadian biology deals with your synchronization with the sun itself. The sun, we think that sun is just helping with the vitamin D. There's a lot more going on there, right? It's supposed to, simply put, it's basically our battery, the power source for our cells,
Mm.
right? And even if you look at our red blood cells, and if you compare the structure of a chlorophyll, for instance, pretty much the same in the sense that we're able to obtain the overall energy from the sun itself in creating ATP as well as creating that particular easy water I mentioned about, right? And
The
there's a
structural water, that
structural
fourth phase of
water,
water that
and
coats every single cell of our body.
right. So there's a
Yep.
lot of play into that. It also
Yeah.
plays into how our methylation process actually occurs as well. When you're
Well,
constantly getting blockade with blue light exposure and toxic light, it also affects your methylation process.
mm,
So when I'm working with clients dealing with biotoxin issues, the first thing I actually mention to them is we got to get your circadian biology fixed,
yes.
right? You got to be in that darkness for about at least 1 to 2 hours, even more if you can, to really get your nervous system regulated better,
Yep.
okay? And really getting that melatonin production optimized. But the following morning when you're waking up, you want to wake up when the sun is just starting to peak. That's your daybreak. You wake up, you stare at that sky, that overall blue light,
Yeah.
and that infrared light is emitting from the sun is so powerful to help your circadian rhythm reset, but
And it
also it affects
causes
your
a release of hormones that your
also,
body needs, like for the rest of the day, like all the
yeah,
hormones through that
yeah,
retinal thalamic.
yep.
Yeah.
And then it also helps to control your cortisol awakening response as well.
Yep.
CAR is
Yep.
something that a lot of functional medicine providers end up having to measure through Dutch
Just
hormone
testing.
testing, but that's something that you could easily improve without taking some medications,
Right.
right? So
Right.
that's another thing, and then it also helps to wake you up, right? But it also helps to lower your melatonin at that point in time when you're getting that sun exposure, and allowing the body to reconnect. And there's a lot of plays into doing so. Now, obviously, we want to talk more now, but
Yeah.
that's why it's such an important factor that we have to play that when you are dealing with osteoporosis, any type of hormonal dysregulation as well, especially
Right.
thyroid, right?
Yeah. We'll get to
And
that.
adrenal issues, the first
Yeah.
thing you need to do is not taking supplements, get your sleep back in order, and go out in the sun.
Yes, and amen. Can I get an exclamation point on that point? Yeah, I think we were saying that. Well, I know there are a lot of drugs that cause this, but the Synthroid or levothyroxine, which is I think number 3 most prescribed drug in America, has dysregulates the circadian biology or circadian rhythm. Is that right? Is that what we were talking about?
Well,
Is it that drug? Or?
in a sense of anything related to exogenous replacement of thyroid medication, right? Especially when you talk about Synthroid, there's a huge issue with absorption problem because of the dyes that they use and the fillers, especially certain things like
Thank you for saying
talcolactose.
that.
Right.
Dyes and fillers and drugs, they exist. Sorry, go ahead.
Yeah, so that's not really helpful
Huge.
either. But
No.
it also depletes calcium,
Yes.
magnesium, iron. It depletes selenium, which you need for the T4 to T3 conversion, right?
T4 is your not active.
Not
T3
active.
is your active. So we want to convert it to T3.
Yeah.
And if you don't have
So
selenium, then don't do that.
that's that. Zinc is another thing that could actually be affected, and then vitamin D, right? So these patients end up having to have low vitamin D to begin with, and then you're actually supplementing. I'm not a big fan of giving extra vitamin D either. There's a whole
Yeah, there's a
reason
whole.
why your vitamin D level is low that we could discuss that later. But you could also have depletion of B vitamins as well, especially B12, because long-standing hypothyroidism actually causes low stomach acid to produce, leading to poor absorption of B12 and other B vitamins after starting Synthroid. And the
Wow.
clinical impact actually
So
can
there's a
occur, right?
there's
There's a
this
whole thing,
spiral down, right?
right?
This is
So you
why
have
when we start on
fatigue,
one drug, we end up on 4.
correct. You're dealing with fatigue, brain fog, neuropathy, right? We keep forgetting about neuropathy, the pain issue, receptors all relates to thyroid function as well,
Yeah.
and poor gut function,
Right.
right? So these are the things, including vitamin D. Having low vitamin D can cause that. So there are studies where I used to compound this years ago, where we used to compound topical vitamin D for neuropathy, and it's been very
Wow.
helpful for neuropathy issues and especially heel spurs,
Wow.
right?
Go figure. Who
Right.
knew?
So
I didn't know that.
and that because vitamin D is able to modulate the immune system inflammatory response, and vitamin D also helps with the bone health as
Oh,
well,
wow.
right? Which
Yeah, that's
we
true.
all know.
Yeah, we all know.
But
Yeah.
this is the part that it's really missed. So when you are getting that proper sun exposure, making that vitamin D, but it's not just vitamin D3 you're making, there's multiple other metabolites of vitamin D
All right.
come into play to modulate your immune system, helps the
Yep.
mood, immune regulation, inflammatory response, as well as act as a
It's a hormone. D3 is
there's
a
a,
hormone.
there's a
D is a
hormone.
hormone. Yeah.
Yeah, it's not just a vitamin.
Communicates. Exactly. Hey guys, I wanted to pop in, interrupt our podcast to encourage you guys and let you guys know, if you didn't know, our book is available. Stephen's story about his struggle through Lyme disease. Our book, Kids Get Lyme Disease Too. One Boy's Journey of Trusting God Through Lyme Disease. It is available on all areas that you can get books, everything from Amazon to Barnes & Noble to everywhere in between. All the places that you pick up books, you can pick up our book. So please support us and get the word out. If you have a child that's struggling, it doesn't have to be Lyme. I know so many children who just feel weird because their health doesn't match that of their peers, and they feel isolated, they feel unseen, frustrated, and alone. This book is meant to encourage those children. It's meant to encourage you parents that you can get through it. It's meant to make you feel seen and heard and give you hope. So please pick up our book. Thank you so much for supporting our podcast and all the things that we do. You can see it's an ever emerging thing. I'm changing my studio. Today I'm wearing scrubs because this is the only time I've had to record, and I'm doing the best we can. And I appreciate that you guys are here with me at the root level, at the ground floor, as I'm trying to get information out to you guys that is valuable and hopefully life-changing, starting with the book. So pick up the book wherever you can pick up books, and thank you in advance for all your support. Synthroid has some downstream effects, and is a classic example. One of the ones I wanted to talk about was albuterol, because I do anesthesia, and the basis of albuterol I think is really interesting. There's fluoride in albuterol. Did you know that?
Yep.
I'm sure you knew
Well,
that.
there's
Of course
a
you
lot
did.
of drug. There's a lot of drug that has fluoride in it. So,
Yeah.
at my lecture that I did for Cellcore back in 2023, I talked about being fluxed. So there are certain antibiotics called fluocinolones causing a permanent mitochondrial dysfunction and damage that goes on.
Wow.
But the
that was a
risk
permanent.
factor, right? So the risk factor of being fluxed is, yes, there are genetic issues, especially when you have G6PD or COMT issues, including MTHFR. But the other issues, the risk factor of putting drugs that containing fluoride groups together. So commonly when you're talking about fluocinolones, you could be having prescription of NSAIDs, ibuprofen, naproxen. Those all contain fluoride group.
Ha! I didn't know that.
Prednisone that also contains fluoride group as well. So we have putting those together, the risk factor of being fluxed becomes higher.
Oh, wow.
And then after dealing with being fluxed, you cannot take some of the drugs that containing fluoride group either. Atorvastatin, rosuvastatin also contains fluoride.
What?
Clobetasol, fluticasone also contains fluoride, right? All PPIs, lansoprazole, esomeprazole, Prilosec, all those contain fluoride groups as well, right?
Oh my goodness.
So, I had a podcast interview with Dr. Scott Scher, and he was just like, I don't believe it. He looked at it, I was like, oh my God, there is fluoride group in it. It's like, yeah, there's fluoride group.
Yeah, it sort of started. I started down this rabbit trail with that one. It's because anesthetic drugs are all fluoridated gases. And so, the high concentration. So it makes me now, and it made me question, the why some people react a certain way under anesthesia,
Mhm.
and from a different perspective, right? From this holistic view of like, what drugs were they on? What kind of, it's the same thing with the floxing, like you putting fluoride groups together. Well, we give albuterol all the time, in
Yeah,
anesthesia,
absolutely.
combined with an antibiotic, combined with this, combined with, and these people have 15 drugs on their drug list. And surely that plays a role into a lot of what we see and what we don't see, that chronic post anesthesia, post surgical cell danger response.
Yeah,
you know
issue as well. So
yeah,
I
yeah,
usually recommend clients in this scenario to really help to detoxify that anesthesia issue by taking liposomal phospholipids and especially supporting the cell membrane structure. So I usually recommend body bio and then their balance oil to fortify the linoleic and alpha linoleic you need to really help that
yes,
aspect of it.
huge piece.
Also, sodium butyrate. Butyrate actually
Hmm.
plays a huge role to help as a chemical
And so
chaperone.
many people are deficient in
Yes.
butyrate.
Yeah, it
Yeah.
actually acts as a chemical chaperone to getting toxins away from the cell membrane and the DNA. And
Wow.
then also TUDCA is a
Love
helps
Tudka.
to unfold that protein misfolding that goes on,
Yeah,
but
that's so
also
cool.
protects the DNA, and then also putting less stress on the endoplasmic reticulum.
Right,
So
right.
a lot of role of these different nutrients to help with detoxing some of the fat soluble drugs out of the cells. So that's why I
It's
would
amazing.
recommend. This actually goes into like diazepam as well. Like when you're taking any type of benzodiazepines, it also affects the
Yeah.
cell membrane structure. It depletes the phospholipids.
Oh
So
my gosh.
when I'm working with clients dealing with, you know, not able having heavy amounts of withdrawal issues from
Yeah, yeah.
benzodiazepines, I usually put them on a phospholipid therapy using Body Bio PC and balance oil, along with really getting the gut line fixed. Another
That
thing
totally
that's
makes
really
sense.
helpful is full spectrum CBD because it actually creates
Yeah, full spectrum
homeostasis
CBD.
and working with the endocannabinoid system as well.
Yeah, the one that we don't have tons of information about that yet. It's coming. The research is there. We don't know what to do with that endocannabinoid system except give CBD, right?
Yeah.
But
Oh,
it
there's a
affects
lot
so
more.
it touches so much. It has
Yeah.
such an impact on our inflammatory response and
Yes.
everything.
The
Hormones.
hormones,
Yeah.
there's that. And then also when you talk about the endorphin system as well, the endorphin system and the endocannabinoid system actually goes hand to hand in doing
Mm.
so. So when you talk about like anandamide is a particular endocannabinoid that your body actually produces, right? But that's produced and then you actually feel euphoric when the
Right.
body's producing that,
Yeah.
right?
That's why we go for running. Runner's
Yeah,
high.
exactly, exactly. That's what it comes out to, and this is a great way to, supplement with that within our body on our own endocannabinoid to
Right.
help inflammation as well. But also, when you're sleeping, that's when the endorphins end up having to decrease at the same time.
Yeah.
So,
Yeah.
sleep
Yeah.
is very important. But going back to your albuterol discussion, so albuterol, you mentioned about the fluoride issue, but potassium could be depleted, magnesium, calcium as well.
I
You're
hear
talking about
potassium, magnesium, and calcium and iron a lot from what you're saying with depletion of these drugs.
drugs because it actually causes an electron transport chain to be in a haywire, right? So that's a
Hmm.
part that you really have to do. And a CoQ10 is more the fact that certain studies in albuterol, they saw that there's oxidative stress going on, increasing when you are using chronic beta agonist use.
Hmm.
So
Which are
that
your
in
albuterols.
itself may end up having to deplete CoQ10. There's not much studies to show that, but we could kind of guess that it may cause it.
Yeah. And, what do we do? What I did a lot as a child, as a young mother with a child with asthma, was I gave him prednisone, albuterol, and antibiotics. So the poor kid didn't have a stand a chance, right? He got
Yeah.
steroids, albuterol, and wrecked his gut microbiome. Poor kid couldn't absorb anything.
And then on top of giving them multivitamin with fluoride, I still don't know why that's still being prescribed, right? And then when we already know that it can cause neurotoxicity,
Right.
and then having poor effect on the thyroid gland. So
Yep.
when you're talking about kids nowadays with metabolic health, is it because of toxin issues, poor eating habits, sedentary lifestyle, or is it because of the fact there's all medication related problem?
Polypharmacy at age 4.
Right.
you
Right. And
know,
then you talk about like amphetamine drugs for ADD issues that
yep.
also cause mitochondrial dysfunction as well.
And that causes a developmental issue.
Correct.
The last drug category I really wanted to touch on is antihistamines.
Okay.
Because, I mean, we use them all the time, and this is now April, so I'm sure it's pollen season somewhere.
Okay.
What I ran across, first time I really saw the chronic nature of antihistamines was this nurse I used to work with. Poor thing had a pterygium, which is that like abnormal growth in the side of her eye because her eyes were so dry because she was
Mhm.
taking antihistamines 3 times a day, something like that, and had been for years. And it was still, her histamine problems were still through the roof. So what happened there? Why was she having to have this accelerated amount of antihistamine use, and why did she get all this pterygium? And what is the problem with antihistamines? Because I hate them.
Well, there's a certain roles of antihistamine can play a huge effect. I mean, there's different classes of it, right? There's other generation of antihistamines. So, for instance, you talk
Yeah.
about hydroxyzine and diphenhydramine. Those are
Mm-hmm.
more of a first generation where you have a much more sedative effect and
Works in the
cholinergic
brain.
effect as well,
Mm-hmm.
right? So those are
Mm-hmm.
two plays into that. So, diphenhydramine, you could also cause, and long-term use of it actually can cause amnesia,
Yeah, I heard it
right?
is linked to dementia
Dementia as
as well.
well,
Yeah. Yeah.
Alzheimer's especially.
Mm-hmm.
So
Mm-hmm.
there's a huge role of anticholinergic effect from those particular two drugs. Hydroxyzine has been used in for psych patients to act as an anti-anxiolytic drug.
Yes, that's
So
right.
there's a multiple
That's
play
all
into
I see
that.
now. That's all
Right,
only way I see it now.
right. And then you
Yeah.
talk, well, there are certainly, if you have a severe body rash or food allergy issues, I've seen dermatologists and other primary care doctors end up having to prescribe hydroxyzine, and they work. They work well. It's just very sedative. And then you're talking about the second generation. You talk about like
Zyrtec,
Claritin,
Claritin.
loratadine or Claritin really doesn't really work well. You talk about cetirizine, which is Zyrtec, fexofenadine is Allegra, and then you have um, S-loratadine, which is Clarinex. So that's a S enantiomer of loratadine, actually
Right,
more direct effect
right,
on the receptor and works very well. But the issue is that it's just a one-sided coin we talk about when you talk about histamine response, because not
right,
only histamine, you talk about other inflammatory cytokines and
right.
inflammatory cells that come into play. So I
Mm-hmm.
like more of an approach that, quercetin, which is a mast cell stabilizer, adding in things like boswellia, cat's claw can be very helpful in the process, right?
Mm-hmm.
So there,
Huge.
and then N-acetylcysteine as well. There's other ways to really managing allergic response. Um, but when you're using chronic use of antihistamines, it actually can indirectly cause or worsening nutrient imbalances in multiple
Yeah.
mechanisms.
Mm-hmm.
So especially gut barrier impact as well, immune
Yeah, it's
modulation.
huge, right? Doesn't it reduce your
Yep,
pH levels in your
pH
gut?
as well, and then
Yeah.
metabolic. Well, talk about H2 blocker, right? H1. I mean, there's H1 and H2 receptors in the gut lining. Yes, it's going to also affect the amount of stomach acid being produced. So things that it's going to deplete vitamin B6, right? Histamine metabolism is dependent on B6,
Whoa.
and then a chronic suppression of histamine can actually alter, methylation and then also
There we go
enzyme
again.
reaction requiring B6. So
Mm-hmm.
clinical impact of low B6 can actually be irritability, depression, anemia, could
Sure.
be nerve issues,
Yep.
such as tingling or numbness,
Mm.
and then worsening of the immune dysfunction. And then vitamin C as well. So that's a natural agent that could
Mm-hmm.
actually break down histamine, right? Vitamin
Right,
C is very
right.
powerful in doing that. But when you're depleting vitamin C, the chronic allergic state or that could actually get worsened and
Yeah, of
increase
course.
this vitamin C being turned over a lot more. So
Yep.
poor wound healing process,
Yep.
immune dysfunction again, fatigue and prolonging of the allergic response. Uh, Again, our favorite friend, magnesium is another one because
Yep.
magnesium actually acts as a mast cell stabilizer,
Which is
right?
keeps us from making histamine.
Correct. So
Right.
magnesium deficiency, you're actually causing more hypersensitivity problem with this. So chronic use of antihistamine is not a good idea. And
Chronic use of
then,
antihistamines lead to needing more antihistamines
correct.
and worsening nutritional imbalances. And so this is an interesting, so that's sort of the repetitive story I'm hearing, starting from all the way from when we started talking about statins and the deficiencies that they cause the chronic use of these are going to lead to deficiencies in our nutrients. They are, period, full stop. And so what's the question? What do? We don't throw the baby out with the bathwater, but we need to be aware, right? These drugs cause a deficiency. And if we're going to need to use these drugs for whatever reason the doctor prescribed, we have got to use our God-given reasoning ability to know that we're going to prevent a lot of problems down the road if we intentionally, deal with the things that are going to be downstream affected from these drugs. So we call it, what do they call that? Second generation medicine, or whatever we call it. I don't know, Dr. Peter Attia named it something like, I don't know, next generation medicine or something like that, where we use medicines, but we also try to prevent the downstream effects from said medicines.
I think that the next generation of medicine should be really dealt with looking at the person as a whole, not only the body, but the soul as well.
Amen, brother.
And really looking at the nervous system dysfunction and how that person's overall genetic, but also their past trauma and the family history, and
100%.
then related to that, because that in itself really plays into who you are as a person.
Right.
Because that particular DNA and then the overall epigenetic you actually have, it came from your ancestors and your family.
Right.
And that's what you end up having to take on. And then when you are adding in additional information on top of that, now you're actually passing on to that particular poor information to your next set of offsprings, which now, when you look at the overall history of humans for the past 100 years, they're not getting healthier. They're actually getting worse.
You're getting life expectancies declined.
Correct.
Which is unheard of. We're in the modern era. We have modern medicine. It should have been improving, right? Longevity should be improving, but it is not.
It's not. And I think there's a huge impact of EMF exposure as well as blue light that's actually constantly happening.
Yeah.
Because there was a discussion about the overall development of a electrical circuit by Nikola Tesla, and then leading into where we are, people are getting sicker and sicker. So that that polarity change that goes on affecting our overall cell membrane structure and our resiliency, but also affects your immune cells.
Right.
But there's another play of overall EMF now. You're dealing with Wi-Fi, you're talking about cell phones,
right,
and then you're talking about EVs, like electric vehicles. They're really bombarding our entire atmosphere, our body, with these toxic EMFs. Now you're actually risking yourself even more, right? So there is a new thing now. It's called the EMF toxicity that
100%.
we have to talk about. It's everybody's pointing on the wrong culprit. It's not the parasite. It's actually, there's a lot more play into the environmental factor that
100%.
goes on. And that's the main thing that I discuss a lot about when I work with my clients. The first thing we need to do is, I'm not talking about parasites. Let's get your environment cleaned up.
Right.
And then really, and then do some auditing of, is there anything that we could potentially shut down or get rid of within the environment and clean out, so this way you actually have a safe environment. You got to remember,
that environment includes relationships.
Yes, that as well. I mean, that's the part that I talk about as well. But that in itself creates a particular atmosphere for your cells and your body and your soul to feel safe.
Right.
Right. If you don't feel safe, that's where you end up having to react to multiple things. And I mentioned also about your threshold level to handling stress response, right? Some people are having a higher threshold to respond to stress, and they're very resilient. But when you have a very much of a low resiliency to handling stress, well, that little trigger, psychologically, physically, emotionally, right, that is going to affect multiple issues. So when you're seeing clients dealing with mast cell activation, especially when you talk about antihistamines, they're going to be heavily depleted with nutrients, especially B6 and magnesium, right, including vitamin C. They have a high levels of innate immune response going on.
Right.
And every little thing is going to end up having to trigger them.
That's right. That's right. Yeah, and just to circle back to your story, I mean, you mentioned it. There was trauma in your background that I guess you realized it in your crisis moment when you were when reviewing your whole life's history, when you had your heart attack at age 33. I remember coming across a study because I do a lot in the Lyme space and the brain space. And that was just a mind-blowing study. It said something like 65% of people diagnosed with Lyme have a history of trauma in their childhood.
Yep.
And that didn't surprise me later, but it did at the first time I read it, because the first time I read it, I had no, background in the holistic space. And I was just like, what does trauma have to do with Lyme disease, But, now we know.
Yeah.
So we are more than just biology and physiology. We are mind, body, and spirit.
Mind, body, and spirit. There's a lot of interplay into who you are, what you get.
And it's way more complex. I mean, you're talking about circadian biology and all the impacts. Like, that's just one layer. And then we talked about the drugs, and that's another layer. And we talked about the nutrients and the communication with the cell and the cell dangers. That's another layer. Can we see how complexly beautiful the body is? It's amazing to me.
It is. But one of the things that are, I think the functional medicine curriculum right now is so sectionalized, of just looking at the gut, just the hormone, issue dealing with brain development, or just looking at peptides these days. We're missing the entire picture of what's happening in the body in itself.
100%. Right. It's all interconnected. That's right. Yeah. Well, I'm going to end on that, because that's a good way to bring us to a close. It was such a great conversation, and I'm glad we touched on all these common drugs that I hear all the time. I mean, we could literally do a podcast on each of them and really dig into the physiology, but that becomes a lecture. This should be fun.
Yeah.
So I really appreciate you coming in and
Thank you.
kind of making it less of this boring Sandra talking about pharmacology and more personal, because it is really what it's about. It's about the person, the people we're trying to help. So I thank you for what you're doing. I hope you keep doing it.
Thank you.
And I hope to have you on again soon.
Yeah, absolutely. Let's do it again.